A new administration takes over with an ambitious plan to vaccinate 100 million people in 100 days. Connecticut is credited as one of the states that's getting vaccine distribution right. But there are obstacles. State Chief Operating Officer Josh Geballe is here to talk about why our system is working and what challenges we face as the pandemic drags on. As more of our neighbors, friends, and family get vaccinated, will we see COVID cases dwindle? We're talking about the impact the vaccine could have in the months ahead and how those new, faster spreading variants might impact any progress we are making. Dr. Jessica Abrantes Figueredo, a member of the state's vaccine advisory group, joins us. Plus, keeping things positive in a time of turmoil, the pledge leaders at Connecticut's Capitol are making. It's all this Sunday, January 24th, 2021.
From Eyewitness News, this is Face the State, Connecticut's most watched local political program.
Well, happy Sunday morning to you. I'm Courtney Zeller. Over the past 2 weeks, we've seen multiple COVID vaccination sites open around the state, aiming to get those vaccines into the arms of residents 75 and older, the people in the top tier of the 1B group. The state is being credited with having a good plan in place to tackle such an overwhelming task. But with places like New York City being forced to shut vaccination sites this weekend because they've run out of vaccines, do we need to be concerned that Connecticut's plans could go off track? Well, joining us this morning to talk all about that is Chief Operating Officer for the state of Connecticut, Josh Geballe. Good morning, Josh. How are you?
Morning, Courtney.
You know, New York City canceled 15 vaccination clinics because they are out of doses. So what's the situation here in Connecticut? Do we need to be concerned that we will run out of vaccines for people who have scheduled appointments?
Yeah, no, I don't think so at this point. We're doing, I think, a reasonably good job so far of planning ahead for the number of doses we're getting per week and the how they're being deployed and how they're being matched up against appointments. So this past week has actually been a great one for us. We got an additional 50,000 doses, which about doubled our usual weekly supply. So we've been putting that to work. But we've had great cooperation with our providers, our hospitals, our federally qualified health centers, local health departments, making sure we're budgeting those doses very carefully so that they're there when the appointments come up.
What do you think is the most important thing you've gotten right that some states struggling with distribution are getting wrong?
Well, you know, the governor's talked often about this balance between, on the one hand, micromanagement, creating lots of rules, lots of very strict guidelines and penalties for how the vaccines roll out. And on the other extreme, the Wild West, which we've seen in Florida and some other places where they just kind of swing the doors open to everybody. And you've got senior citizens having to camp out on sidewalks overnight to hold a place in line. So what we've been trying to do is find that middle ground that enables us to partner with our providers in the state who are doing the actual vaccinations, work with them collaboratively to make sure we're getting the doses where they can get out to people as quickly as possible, but also making sure we have good coverage across the state, making sure vaccines available to people in underserved communities where we need to reach out to them more proactively.
Sure. And I'm going to throw some numbers at you. There are 3.5 million Connecticut residents and about 1.5 million in that 1B group. When you add in healthcare workers from the 1A group, how many eligible people do you think are left? And how fast do you think we can get these vaccinations done?
Yeah, that's the key question, right? And you know, we're off to a fast start as a state. As we sit here right now, we're number 3 in the nation in terms of the highest percentage of our population that's been vaccinated. We've now vaccinated over 20% of our seniors, the people 75 and older. So we're really putting a good dent in phase 1B already. But as you said, we've got from here we go to people who are 65 and older. We're hoping to be able to open it up to them in early February. And then we go to our frontline essential workers and other people below 65 who have pre-existing conditions. That group is pretty large. We expect to hopefully get through there by the end of April. But again, we can accelerate that if we can get more doses from the federal government. That's really the limiting factor right now.
Yeah, let's hope for that. President Joe Biden, of course, took office this week and signed a series of executive orders related to the coronavirus. So, Josh, what changes do you expect to come to Connecticut from these orders and from the new administration in the near term?
Well, we're really excited. We're already seeing a level of communication to the states, which has really stepped up. Some much more consistent guidance to the whole nation about the importance of wearing masks. That we really think will, things we've been doing in Connecticut for months now, but that this is a team effort, right? What's going on in Connecticut is so impacted by what's going on around the rest of the nation. And so that type of leadership from the federal level is really welcomed. We're also excited about some of the smaller details that were announced. We're going to get full reimbursement for our National Guard troops who have been deployed to help support vaccination sites around the state and all the other important work they're doing. But what we're really waiting for and hoping for is just increased supply of vaccines coming into the state. And I know the president has now put in place the Defense Production Act to help the manufacturers scale that up even faster.
People are, of course, signing up for the vaccine, those who are eligible through different hospital systems. We have 211, also through VAMS. We've been asked by some viewers, why isn't there just one phone number and one website?
Yeah, it's a great question. It would be nice if there was just kind of one central front door. The reality is our healthcare delivery system in this state and in this country really is pretty fragmented. And so in the interest of going fast, we've tried to work within some of those constraints and give flexibility so that people can book directly with a hospital or a healthcare provider that they have an existing relationship with, but also to provide resources for people who don't or who want to be able to talk to a person on a phone to book an appointment. So we're trying to keep those numbers of front doors to a minimum, but at the same time, make sure we're going as fast as we possibly can and working within the structure that we have.
What about those who are homebound? I mean, we've heard from many relatives of people who they just aren't able to leave their home. So how will you get the vaccine to them?
Now, it's a great question, and it's a challenging question as well, because as many people probably know, these vaccines from Pfizer and Moderna come in multi-dose vials, and they have to be stored at very low temperatures and handled very carefully so that it doesn't set up well for a single dose being delivered to someone's home. So we're working with the healthcare providers and people who do provide home-based care on some options there. But certainly the easiest approach and the fastest approach in the short term would be if you have a family member or someone who can help you get to one of the vaccination sites. But we are working on other solutions for those who can't.
Okay, that's great. The next group of people eligible in the 1B tier are people 65 and older and those with underlying medical conditions with increased risk for severe illness. So how do those with an underlying condition know that they're even qualified? Do they need a note from their doctor? Should they talk to their doctor?
Yeah, so the CDC has published a list of conditions that put individuals at particularly high risk for severe outcomes related to COVID-19. We're going to be working off of that list. And as we get closer to the date at which the program opens up for those folks, there'll be much more guidance provided and very clear instructions about, what documentation is required to be able to get a vaccination.
And lastly, Josh, best case scenario, when do you think those who want to be vaccinated in Connecticut will be vaccinated?
The million-dollar question. Look, if we don't see increased supply of vaccines coming into the state, it could be end of the summer is what Commissioner Gifford and our team at the Department of Public Health have kind of forecasted. But we are hopeful that we'll see those supplies increase. We've seen some exciting announcements. The governor was on the phone actually just this week with executives from Pfizer talking about their plans to scale up their production. We have new vaccines potentially being approved soon from Johnson & Johnson, Janssen, and maybe AstraZeneca as well. So there's a lot of moving parts, all of which hopefully will help us accelerate further. But the thing that people in Connecticut should know is that we're ready. We've got the infrastructure built up here to move much faster as soon as we get the additional doses, and we're just hoping that they come.
Some great information. Thanks so much, Josh, for joining us this morning. We appreciate it.
Thanks for having me, Courtney.
Sure. Well, we continue our COVID conversation in the next segment when we're joined by one of the doctors in the state's COVID vaccine advisory group. We're talking about what we've learned in the past year about treating COVID, the challenges these faster spreading variants present, and the hope the vaccines bring in this new year. We'll be right back.